Acute respiratory distress syndrome. It is a clinical syndrome which affects preterm infants, affecting more than 70% infants of 28 to 30 weeks gestation. Actually, it is due to the surfactant deficiency which lead to the poor lung compliance and ultimately it lead to the alveolar collapse. It's a clinical syndrome affecting preterm babies within 48 to 96 hours after birth and characterized by cyanosis, chest indrawing, and bilateral infiltrates on chest X-ray and retronodular shadow on chest X-ray. Risk factor, actually it is due to the surfactant deficiency, and the most important risk factor is prematurity. Pathogenesis, it is due to the lack of surfactant production, by type 2 pneumocytes. It leads to the increased surface tension and ultimately alveolar collapse. What is the management? The first management is good antenatal care. Manage the risk factor of prematurity. Number 2, steroid cover. Its indication is every lower segment C-sections. 3 is perinatal or antenatal care. Assessment of the maturity for amniotic fluid by amniotic fluid sampling. In this case, we can know about the lecithin and sphingomyelin ratio. Sphingomyelin. Its common ratio is 2:1. Clinical features: tachypnea, heart beats greater than 60 breaths per minute, cyanosis, chest indrawing, nasal grunting. These are the clinical features. On chest X-ray is reticulonodular shadow. It means bilateral infiltrates on chest X-ray. What are the treatments? And one thing is more important, according to ABGs, type 1 respiratory failure. In type 1 is hypoxemia, oxygen level is decreased and carbon dioxide sometime decrease or sometime normals. What are the treatment of acute respiratory distress syndrome? The most important thing is neonatal resuscitation. For that purpose, we go for mechanical ventilation, correct fluid electrolyte imbalance, treat the acidosis. Specific treatment: surfactant replacement, surfactant replacement, and phospholipids about 100 mg per kg. Despite of treatment, mortality rate is 40%. Mortality rate is about 40%. So this is all about the acute respiratory distress syndrome. Thank you.